Hi there, it's Dr. Heyer from Holistic Health, where we use functional medicine to help sick people get well and help well people stay healthy. In today's video, we're going to briefly touch on the differences between conventional versus alternative health care when it comes in regards to dealing with or helping people with ADHD. So some of these things you may already be familiar with. The standard approach when a parent thinks a child might have ADHD or has ADHD-like behavior, oftentimes the parent will take the child to a therapist or a counselor for evaluation and they'll start therapy, or they'll even take the child to a primary or medical doctor where the doctor has a couple of options as far as what types of medications might be prescribed. There's actually two categories. The first category are medications that are stimulants, and you may recognize some of these names. Some of those names are like Adderall, Concerta, or even Ritalin. Those are pretty popular or pretty common, and for a lot of people they've been life-changing and beneficial, but for some folks, some children, there's some side effects or they don't do so well on those. And that leads us to the second group of medications, the non-stimulants. Again, you may recognize some of these names, like Strattera, Clonidine, or Guaifenesin. And again, life-changing for some people, and for others, they may actually make the individual worse. And unfortunately, they don't help everybody, which is why a lot of parents come to me and say, hey doc, we've done therapy, we've done the different medication, we've tried the conventional route, our child isn't getting better, in fact, in some cases maybe getting worse. Is there something more that we can do to help our child? Is there something different or more natural in a safer way to help our child? And yeah, that's what we do here in the office. So one of the things that I have to share with the patient is, or the mom or the dad, is that your child doesn't have ADHD because they have a Ritalin deficiency or an Adderall deficiency. I know that may sound kind of tongue-in-cheek, but you're not experiencing that condition because you have a deficiency of that drug. That drug isn't something our body needs for normal function. But there are three things that, if missing or altered or out of balance, can be contributing factors to ADHD. And just like this stool has three legs, those three contributing factors are food sensitivities, minerals and vitamin deficiencies, or even essential fatty acid deficiencies, just call it nutrient deficiencies, and heavy metal toxins. Those are three things that could be affecting a child that, if not looked at, well, could be very easily missed. And so that's what we do here in the office. We like to look at finding any food sensitivities that could be causing inflammation in the body, and then of course reducing those. Address any nutrient deficiencies, get them on good minerals and vitamins, and making sure their fatty acids are balanced. Remove any toxicities that are found, and something that a lot of other doctors may not know or acknowledge is finding out if the brain is inflamed and help to quench that fire. Look, if a child's brain is on fire, you can't expect them to just sit still. You can't say, hey, little Jimmy, sit still, and you can't behave away these issues. These are not things that you can change behaviorally. If a child's brain is on fire, of course they're going to be antsy and hyperactive. But if you don't evaluate and look for those things, you'll never find that they're there. And so that's why we're not really treating ADHD. We're actually looking to find the underlying causes and correct those underlying causes. And that's what we do in the office. And what I like to extend to you as a thank you for taking time to watching this video is a complimentary consultation. Normally that's $49, but absolutely free. We'll schedule a 15-minute consultation on the phone. You don't have to come into the office, and there's no obligation. I want to hear your story. You know, maybe you have a child who has been diagnosed with ADHD, or maybe not diagnosed, but you suspect those behaviors are kind of going in that direction. I want to hear your story and see if you're a good candidate for what we do here in the office to help you and your family. So feel free to go to our website, www.adhd-frankfurtil.com, or give us a call at the office on the number on your screen and let my assistant know, say, hey, I saw the video and I'd like to schedule my complimentary consultation, and she'll take great care of you. Thanks for your time, and before I go, could you do me a favor, smash that like button, and please share this so that other people know that there are other options out there. There are so many parents who feel hopeless, like there are no other options to turn to, and please let us share the hope that there are. Thanks. Have a great day.